We were working on the food label for all processed foods, right? And this is to put the label on all things that were sold in the supermarket. And we had to work it out because, many products, if they contain meat products, are also regulated by agriculture. And we worked on that design. And one day the Secretary of Agriculture said to me, I really don't like the direction this is going. I don't like this food label. We're not going to put this food label on all our processed foods that contain meat and chicken. And he said, I'm going to take the issue to the president. I said, you're what? So fast forward into the Oval Office. George Bush, the father, Dan Quayle, the vice president, Marlin Fitzwater, the press secretary to the president, James Baker, who was Secretary of State and then Chief of Staff, the Secretary of Agriculture, the Secretary of Health and Human Services. 6 guys who've never cooked in their lives deciding the fate of the food label. And I had been with the kids to McDonald's. McDonald's you've never been there, I know, these tray liners, on the trays you get, and we had worked with the McDonald's to put that nutrition facts panel on that tray liner. And I stuffed them in my pocket when I went with the kids. And so the Secretary of Agriculture says to the President, the FDA lost its mind. It's not going to make all food producers change their label to include the nutrition facts information. And at that moment, whip out the McDonald's tray liner and hand it to the President of the United States and say, Mr. President, if it's good enough for McDonald's, it should be good enough for the Department of Agriculture. And at that moment, right, the President sides with us. You have these 6 guys looking at this McDonald's placemat, right? And that's how policy is made in this country. Over about a 3-month period, she lost 30 pounds, right? Because she was reading. We all know it's not, weight was an issue. But we really, to really understand, we talk about, healthcare reform. Billions of dollars we spend on drugs for lowering cholesterol, blood pressure, diabetes. And at the core of it lies weight and obesity. And I could relate. I have suits in every size. And, I was trying to get a handle, right? Why is it so hard? If it were just a question of diet and exercise, we'd all be doing it, right? There was something that was more complicated. One night I'm watching the daily rerun, surfing through the channels, and I'm watching Oprah. And there was a woman on the day's show, and it was part of the segment with Dr. Phil. Don't get me started on Dr. Phil. But she comes up on stage, and very well educated, very well spoken, very sophisticated, and she says, and I remember this vividly, she says, I eat when my husband goes to work in the morning. I eat before he comes home at night. I eat when I'm happy. I eat when I'm sad. I eat when I'm hungry. I eat when I'm not hungry. And then she said, and I don't like myself. And at that moment, I was trying to listen as a clinician. Right? I was what was I hearing? Here was a woman who was successful in all aspects of her life. Right? But she was doing something with food that she didn't want to be doing. And that was the question that I wanted to answer. What was driving this woman? What was I hearing? What was going on over the last 3-4 decades? Why is it so hard for so many people to resist eating the way we do? First point, first hypothesis. In the presence of a varied and limitless diet, people tend to eat excessively. That's point one. Now let me show you the science for that.